Let's think about making a perfect cup of coffee. If your mug has leftover sugar from yesterday, your coffee might taste sweeter than it really is. The same principle applies to something even more crucial for your health, your blood sugar test. You absolutely must thoroughly wash and completely dry your hands before every blood sugar test because it directly impacts how accurate your reading will be. Even tiny, invisible amounts of food residue, hand lotion, or dirt can significantly skew your results, leading to numbers that do not reflect your true blood sugar level. This is because your glucometer is designed to measure the amount of glucose, which is a type of sugar, in your blood. When you prick your finger for a sample, any substance on your skin can mix with that tiny drop of blood. Sugary residues are the biggest culprits. Think about touching a piece of fruit, a candy wrapper, or even a can of soda. These items can leave invisible sugar particles on your fingertips. If these particles mix with your blood sample on the test strip, your glucometer will read them as if they were part of your blood sugar, resulting in a falsely high reading. Similarly, hand lotions, sanitizers, or even just general dirt can interfere with the delicate chemical reaction that happens on the test strip, potentially giving you an inaccurate result that could be either too high or too low. Trusting these inaccurate numbers could lead you to make incorrect decisions about your insulin dosage, what you eat, or your activity levels, which is precisely what we want to avoid when managing diabetes. So how do we prevent this? It is quite simple and only takes a moment. Start by washing your hands thoroughly with warm water and plain soap for at least 20 seconds. Make sure to scrub all surfaces, including between your fingers and under your nails. Then, rinse your hands completely under running water to remove all soap residue. The crucial next step is to dry your hands completely with a clean towel. This removes any lingering moisture or contaminants. It is best to avoid alcohol wipes or hand sanitizer immediately before testing, as they can sometimes leave a residue or even dilute your blood sample, affecting accuracy. If you do use them, make sure your hands are entirely dry before you proceed with your test. Also, be mindful of your environment. Avoid testing right after handling any food, especially sugary snacks, to ensure the cleanest possible testing surface. Here is a little insider tip for you. Even items labeled sugar-free can contain sugar alcohols which some glucometers might misinterpret as glucose, further emphasizing the need for clean hands. What we are talking about here is preventing something called a pre-analytical error. This is an error that happens before your blood sample even reaches the test strip, and it is a common reason for skewed blood sugar readings. By taking this small but vital step of washing your hands, you are actively preventing one of the most common sources of these errors. This empowerment comes from knowing your numbers are reliable, allowing you to fine-tune your diabetes management strategy with confidence, whether it involves adjusting your medication, making dietary choices, or planning your physical activity. In essence, a simple hand wash is not just about hygiene. It is a powerful tool for accuracy. It is your way of ensuring that your glucometer is measuring your true blood sugar level, free from external interference, rather than a mix of what is on your skin. This small but mighty habit empowers you with reliable information, allowing you to make truly informed decisions that significantly contribute to your effective diabetes management, and ultimately, to your overall health and peace of mind.